Unit 10 Test Questions 51. A home care nurse is visiting a client with a diagnosis of pernicious anemia that developed as a result of gastric surgery. The nurse instructs the client that because of stomach lining produce the decreased amount of intestine factor in the disorder. The client will need 1. Vitamin B12 injection, 2. Vitamin B6 injection, 3. An antibiotic, 4. An antacid. The correct answer is 1. Vitamin B12 injection. 52. An adult client with hepatic cirrhosis has been following a diet optimal amounts of protein because of neither an excess nor deficiency of protein has been helpful. The nurse evaluates the client's status is being most satisfactory if the total protein level is which of the following values and within the normal range. 1. 0.4 g per dl, 2. 3.7 gram per dl, 3. 6.4 gram per dl, 4. 9.8 gram per dl. The correct answer is 3. 6.4 g per dl. 53. A client arrives at the emergency department complaining of acute right lower quadrant abdominal pain and appendicitis is suspected. Laboratory tests are performed and the nurse notes that the client's white blood cell count is elevated. The nurse is reviewing the physician orders and would contact the physician to question which of the following orders if noted in the client's record. 1. Maintain an NPO status. 2. Initiate an intravenous line with the administration of fluid. 3. Maintain a semi-fowler's position. 4. Apply a heating pad to the lower abdomen for comfort. The correct answer is 4. Apply heat pad to the lower abdomen for the comfort. 54. An ambulatory care nurse is preparing to assist the physician in performing liver biopsy on a client. The client is receiving a local anesthetic for the procedure. The nurse would assist the client is which position for this test to be performed. 1. Right lateral side lying. 2. Left lateral side lying. 3. Prone with the hands crossed under the head. 4. Supine with the right hand under the head. The correct answer is 4. Supine with the right hand under the head. 55. Polyethylene glycol electrolyte solution is prescribed for a client scheduled for a colonoscopy. The client begins to experience diarrhea following administration of the solution. What action by the nurse is most appropriate? 1. Cancel the diagnostic test. 2. Start IV infusion. 3. Administer an edema. 4. Explain the diarrhea is expected. The correct answer is 4. Explain the diarrhea is expected. 56. An adult client with a diagnosis with acute pancreatitis 9 days ago. The nurse interprets that the client is recovering from this episode if the serum lipase level drops to which of the following values, which is just underneath the upper limit of normal. 1. 20 units per lit. 2. 80 units per L. 3. 135 units per L. 4. 350 units per L. The correct answer is 3. 135 units per L. 57. A nurse has been caring for a client with a diagnosis of Sencastrine Balcomor tube. The physician arrives on the nursing unit, deflects the esophageal balloon. Following deflation of the balloon, the nurse would monitor the client most closely for which of the following? 1. Swelling of the abdomen. 2. Bloody diarrhea. 3. Vomiting for blood. 4. An elevated temperature and rise the blood pressure. The correct answer is 3. Vomiting of blood.